If you're a senior on Medicare or you're helping a loved one navigate healthcare, then listen very closely because what I'm about to tell you is something most people never find out until it's too late. Every year, millions of Americans over 65 pay hundreds, sometimes even thousands of dollars out of pocket for dental visits, vision exams, glasses, hearing aids, cleanings, and basic checkups. They assume Medicare covers these things. They assume their plan works like regular health insurance. But the truth is, original Medicare leaves some of the most important parts of your health completely uncovered. And yet, at the very same time, many seniors right now are quietly enjoying dental, vision, and hearing benefits without paying huge bills, simply because they discovered something hidden inside certain Medicare Advantage plans that most people don't even know exist. Today, I'm going to walk you through these hidden perks inside Medicare Advantage. You'll learn what's really offered, how much you can save, what traps to avoid, and how to make sure you're not leaving benefits on the table. So stay with me, because by the end of this video, you'll know exactly how to unlock the kind of dental, vision, and hearing coverage that can genuinely improve your health, your comfort, and your daily life. And if you're watching this right now, chances are you're in the age group where these benefits matter the most. Maybe you're in your 60s thinking about retirement. Maybe you're in your 70s dealing with long-delayed dental work or hearing problems that make conversations harder. Or maybe you're simply tired of paying extra for things that feel like they should be included. Whatever your situation, you're about to get information that could save you stress, money, and time. Let's start by addressing something that many seniors don't learn until after they've already gone to the dentist and gotten the bill. Original Medicare does not cover routine dental, routine vision, or routine hearing services. Not cleanings, not fillings, not dentures, not eye exams for glasses, not your frames, not your lenses, not hearing exams for the purpose of getting hearing aids, and definitely not the hearing aids themselves. For most seniors, that's a shock, and it becomes an even bigger shock when they realize just how expensive these services really are today. A single crown can cost between $1,000 and $1,600. A set of hearing aids can cost anywhere from $2,000 to $5,000, and sometimes even more, depending on the level of technology you need. Prescription eyeglasses, especially if you need bifocals or progressive lenses, can easily run several $100s, and that's before you even talk about follow-up exams, adjustments, or the little issues that pop up during the year. That's where Medicare Advantage plans begin to change the picture. These plans, offered by private insurers approved by Medicare, can include dental, vision, and hearing benefits that original Medicare simply does not. Some plans offer annual dental allowances. Some offer coverage for preventive cleanings every 6 months. Some include comprehensive dental, meaning they help with root canals, extractions, and even dentures. Others offer generous vision allowances that can pay for your frames, your lenses, and your annual exam. And many plans go even further, providing hearing exams and significantly discounted, sometimes fully covered hearing aids. But here's the part most seniors never hear. These benefits vary wildly from plan to plan. Just because a Medicare Advantage plan advertises dental or vision or hearing coverage doesn't mean the coverage is actually useful. I've seen plans where the dental benefit covers only one cleaning per year. I've seen plans that advertise an allowance, but the allowance can only be used for specific providers. And I've also seen plans with incredible benefits, but seniors never take advantage of them because they simply don't know they're available. That disconnect is exactly why understanding your plan matters more than anything else. It's not enough to know a benefit exists. You need to know what it covers, how to use it, where to use it, how often you can use it, and what the restrictions are. For example, some plans offer a yearly dental allowance that acts almost like a prepaid card, where you can spend a certain amount on dental services at any provider that accepts the payment system your plan uses. On the other hand, some plans offer coverage only within a specific network, which means you're limited to the dentists contracted with that insurance provider. Knowing the difference can determine whether you save money or end up with an unexpected bill. Let's talk about dental first, because this is where most seniors feel the biggest financial burden. Dental health is directly connected to your overall health. Poor oral health can increase your risk of heart disease, stroke, and infections. And yet, many seniors put off dental care for years because it's too expensive. Medicare Advantage plans that offer strong dental benefits usually include preventive care like cleanings, x-rays, and simple exams. Some will also include comprehensive dental like crowns, fillings, extractions, and even dentures. But here's the key. The coverage limits vary. One plan might give you $1,000 a year for dental, while another might offer $2,000 or even $3,000. Some might only cover certain procedures up to a percentage of the cost. Some will require prior authorization. That's why you can't assume anything. If you're a senior watching this right now and you're unsure what dental benefits your plan includes, this is your sign to review your plan carefully. Or better yet, call your insurance company and ask them directly what dental benefits you have and how to use them. Many seniors don't realize they already have benefits available to them that they've simply never activated. Now, vision benefits. As we age, our eyes naturally go through changes. Cataracts, glaucoma, macular degeneration, and even simple vision decline can affect your quality of life. But prescription glasses, especially for aging eyes, are not cheap. Medicare Advantage plans often include an annual vision exam and an allowance for frames and lenses. Some plans might give you $100. Others might offer $200, $300, or more. But just like dental, vision benefits can be structured differently depending on your plan. Some require you to use a certain network of optical providers. Others give you more freedom. If you haven't replaced your glasses in a long time because of cost, this is an area where a Medicare Advantage plan can make a meaningful difference. Hearing is another major issue for seniors. Hearing loss affects about 1 in 3 older adults. It can lead to isolation, cognitive decline, safety issues, and difficulty communicating with friends and family. But hearing aids can be incredibly expensive. And once again, original Medicare does not cover them. Medicare Advantage, however, often includes hearing exams and discounted hearing aids. Some plans allow you to get hearing aids for a significantly reduced cost. Some include follow-up adjustments. Some offer multiple technology levels. But you need to know which hearing providers your plan partners with, because hearing benefits can be more restrictive than dental or vision. One of the biggest mistakes seniors make is assuming that all Medicare Advantage plans offer the same benefits. They don't. Each company structures their dental, vision, and hearing coverage differently. Your neighbor might have a plan with $2,000 in dental coverage while your plan only offers $500. Your friend might have fully covered hearing aids while your plan only offers a discount. That's why it's so important to understand your specific plan instead of comparing it to what someone else has. And here's something else that's just as important. Even seniors who have great benefits often don't use them. Companies track this. Year after year, millions of dollars in unused dental, vision, and hearing allowances go completely unclaimed. The benefits expire at the end of the year, and seniors who could have used them for cleanings, exams, new glasses, or hearing aids simply miss out. This is why education matters. This is why awareness matters. And this is why channels like Medicare Mentor exist, to help you get the most out of the benefits you already have access to. Before we continue, let me take a moment to say this. If you're finding this information helpful, make sure to stay until the very end, because in a few minutes, I'm going to give you a simple strategy that will help you identify whether your plan's dental, vision, and hearing benefits are strong, weak, or somewhere in the middle. Many seniors have told me that this one strategy alone helped them save hundreds of dollars and avoid a lot of confusion. Let's go a little deeper into how these benefits can impact your life on a practical level. Let's say you haven't had a dental cleaning in a year or two because you're worried about cost. If your Medicare Advantage plan includes preventive dental, you might be able to get 2 cleanings per year completely covered. That means healthier teeth, fewer problems down the road, and a lower risk of needing expensive dental work later. It also means peace of mind. Now imagine you've been putting off getting new glasses because your current pair still kind of work. Many seniors do this. But when your vision changes even a little, it affects your balance, your driving, your reading, and your comfort. A vision allowance through your plan could let you update your prescription without paying the full price out of pocket. And hearing. This is a big one. Many seniors wait years before addressing hearing loss. They worry about the cost, they worry about the stigma, or they simply adapt by turning up the TV and avoiding situations where they have to hear clearly. But hearing loss doesn't fix itself. It often gets worse. And untreated hearing loss has been linked to loneliness, depression, and cognitive decline. If your plan offers hearing benefits, using them now instead of later can literally improve your brain health, your relationships, your confidence, and your ability to stay independent. Now let's talk about the part I promised earlier, the strategy that helps you evaluate your plan. This is something I always recommend to seniors. It doesn't require tools or computer skills. Just follow this simple process. Find your plan's summary of benefits, either online or in the booklet they mailed you. Go to the section that lists dental, vision, and hearing. For each category, write down 5 things: what's covered, the annual allowance, whether there's a network requirement, how often you can use the benefit, and whether prior authorization is needed. That's it. When you look at those 5 points side by side, you'll immediately see whether your plan's benefits are strong or weak. Seniors who do this often realize they either have excellent coverage they've never used, or they need a better plan during the next enrollment period. Before we wrap up, let me give you a quick but very important reminder. Medicare Advantage benefits change every year. What you had last year may not be what you have this year, and what you have this year may change again next year. If you don't stay informed, you risk paying for things that your plan might already cover. Don't assume. Verify. Review. Ask questions. And most importantly, use your benefits before they expire. If you found this guide helpful and you want more clear, simple explanations that help seniors save money, avoid mistakes, and get the healthcare they deserve, make sure you follow Medicare Mentor right here. This channel exists for one purpose: to help you understand Medicare in a way that's easy, practical, and genuinely useful. And if you want more videos on Medicare Advantage benefits, saving money on medications, or maximizing your coverage, this is the place for you. Thank you for watching. Thank you for taking the time to take control of your healthcare, and I'll see you in the next video.